What is the best blood pressure for someone over 60? The number you have been told your whole life may not be the right number for you now. I'm Dr. Ben Harris, and today I am going to walk you through what the research actually shows about blood pressure targets for older adults and why pushing for the lowest number is not always the safest choice. Here is what most people get wrong. They hear that 120 over 80 is normal. They see their reading at 138 over 78 and think something is wrong. They worry, they push for more medication, they stress about every point. But for many adults over 60, that slightly higher number may actually be appropriate. Today I will share 8 things every older adult should understand about blood pressure targets. And one of them, near the end, is something that connects blood pressure to another health marker that millions of seniors are also watching. The order matters here, so stay with me through all 8. Let us begin with the first one. 1. The standard blood pressure target of 120 over 80 may not apply to you after age 60. This is the starting point because so many older adults are confused by it. For decades, everyone was told that 120 over 80 is normal and anything higher is a problem. But over time, research has shown that blood pressure targets are not the same for a 30-year-old and a 75-year-old. Margaret is 72. She came to her doctor with dizziness, weakness, and trouble concentrating. Her blood pressure had been 146 over 82 for years. She felt fine at that level. But during a routine visit, she was told it needed to come down. Her medication was increased. Within weeks, her pressure dropped to 118 over 70. That sounds like a success on paper, but Margaret started feeling off. She was unsteady when standing. She had trouble thinking clearly. She even fell once in her kitchen. When she returned to her doctor, they checked her blood pressure while sitting and then again while standing. It dropped significantly when she stood up. That explained the dizziness. Her medication was adjusted, her pressure came back up slightly, and she started feeling like herself again. For many older adults, the body has adapted to a higher baseline. Pushing too hard to reach a textbook number can lead to falls, confusion, and fatigue. Current guidelines from major health organizations suggest that for most adults over 60, a systolic target of around 130 to 140 may be acceptable, depending on overall health, frailty, and other conditions. Some individuals, particularly those who are more frail, may even tolerate numbers slightly above that without issue. This does not mean higher is always better. It means that the right number depends on the person. If you are on blood pressure medication, do not change anything without speaking with your doctor first. But understanding that your target may differ from what you have heard for years is an important first step. This supports a more personalized approach to blood pressure management. Before we continue, I want to ask you something simple. Comment below with your age and your usual top number. Is it in the 120s, 130s, 140s, or 150 and above? I read the comments, and it helps others feel less alone when they see what is common for people their age. Now let us move to the second point, because even if you understand that your target may be different, you need to know if the numbers you are seeing at home are even accurate. 2. Knowing how to measure your blood pressure correctly at home makes a real difference. Many people check their blood pressure at home. That is a good habit, but if the technique is off, the numbers may not reflect reality. Robert is 68. He bought a home blood pressure monitor and started checking every morning. His readings were often in the 150s or 160s over 90. He was alarmed. He called his doctor multiple times. He was convinced his medication was not working. When he finally went in for a visit, the nurse noticed something right away. His cuff was too small. Robert had larger arms, and the cuff that came with the monitor did not fit properly. A cuff that is too small will give falsely high readings. Additionally, Robert admitted that he often checked his blood pressure right after waking up without sitting quietly first, and sometimes he talked during the measurement. Once he switched to a properly sized cuff, sat still for 5 minutes before measuring, placed his arm at heart level, kept his feet flat on the floor, and stayed silent during the reading, his numbers changed. His average dropped to the low 130s over the mid-70s. The reading was not the problem. The method was. Here is how to measure correctly. Use a cuff that fits your upper arm. Most monitors come with medium-sized cuffs, but many adults need a larger one. Sit in a chair with back support. Rest for at least 5 minutes before measuring. Place your arm on a flat surface so that the cuff is at the level of your heart. Do not cross your legs. Do not talk. Take 2 or 3 readings, about 1 minute apart, and record the average. Check at the same time each day if possible. Morning readings before medication are often most useful for seeing patterns over time. This gives you and your doctor more accurate information to work with. If you find this helpful so far, consider subscribing. This channel shares clear, calm information on blood pressure and blood sugar for adults over 60. No hype, just helpful tips. Now let us look at the top number specifically, because that is the one most people focus on. 3. The top number, called systolic pressure, has more flexible targets for older adults than most people realize. When you see a blood pressure reading like 138/76, the top number is the systolic pressure. That is the force on your artery walls when your heart beats. For older adults, this is the number that tends to rise the most with age and the one that gets the most attention. Patricia is 74. At a routine checkup, her blood pressure was 142/74. She was worried. She had always heard that anything above 140 was too high. She asked her doctor if she needed more medication. Her doctor reviewed her history. Patricia had no heart disease. Her kidneys were healthy. She was active, walked every day, and had no symptoms. Her doctor explained that while 142 is above the classic 120, it is within an acceptable range for many older adults. In fact, for someone like Patricia, who was otherwise healthy and tolerated that level well, aggressive lowering could bring more risk than benefit. The doctor suggested they continue to monitor it. If it climbed higher, or if Patricia developed other concerns, they would revisit the plan. For now, no changes were made. This kind of conversation is happening more often as doctors recognize that blood pressure management is not just about chasing a number, it is about balancing benefit and risk. For adults in their 70s and 80s, especially those who are frail or have multiple conditions, a target systolic of 140 or slightly above may be reasonable. For healthier older adults, 130 may still be a good goal, but even that should be personalized. There is no single number that is right for everyone. If you are unsure what your goal should be, ask your doctor what systolic target they are aiming for in your case and why. This creates a clearer picture of what you are working toward. Now let us talk about the bottom number. Many people focus only on the top number, but the bottom number also matters, especially if it gets too low. 4. A bottom number that is too low can be a problem for older adults. The bottom number is called diastolic pressure. It measures the pressure in your arteries between heartbeats when the heart is resting. In younger adults, a higher diastolic number is often the concern, but in older adults, a low diastolic number can be just as important. William is 77. His blood pressure readings were usually around 148/56. His doctor initially focused on the top number, which was a bit elevated. Medication was adjusted. His systolic came down to 134, but his diastolic also dropped, sometimes into the low 50s. William started noticing that he felt lightheaded when getting up from a chair. He had moments of feeling faint. He also felt more tired than usual. His doctor explained that when diastolic pressure gets too low, it can reduce blood flow to the heart and brain between beats. For older adults, especially those with stiffer arteries, this can cause symptoms like dizziness or fatigue. A diastolic pressure consistently below 60 can be a concern, particularly if symptoms are present. In William's case, his medication was reduced slightly. His diastolic came back up to the low 60s. His symptoms improved. This is why blood pressure management is not just about lowering numbers. It is about finding the right balance. If your bottom number is often below 60 and you are experiencing dizziness, fatigue, or fainting, bring it up with your doctor. If you stand up quickly and feel unsteady or see spots in your vision, sit back down and move more slowly. This is especially common in the morning or after meals. A steady diastolic reading supports better overall blood flow. Here is another helpful habit. Keep a simple log of your blood pressure readings, including both numbers, along with any symptoms you notice. This can help your doctor see patterns and make better decisions. We have now covered 4 important points about blood pressure targets for older adults. Understanding that 120/80 may not be your personal goal, measuring correctly at home, knowing what ranges are acceptable for the top number, and watching the bottom number too. There are still 4 more things to cover, including the daily habits that support steadier readings, the connection between blood pressure and another major health marker many seniors are tracking, and what to do with all of this information once you have it. If you are still here, you are already more informed than most. We are continuing now with the 5th point. So far, we have looked at why blood pressure targets differ for older adults, how to measure accurately, what the top number should realistically be, and why a low bottom number can cause problems. Now let us talk about what you can do in your daily life to support steadier blood pressure readings. 5. Simple same-day actions can help steady your blood pressure without medication changes. There are things you can do on any given day that may help bring down a temporarily elevated reading or prevent spikes from happening in the first place. These are not cures, they are not replacements for medication, but they are real tools that can make a noticeable difference. Dorothy is 70. She had been managing her blood pressure with one medication for several years. Her numbers were usually in a good range, typically around 132/76, but some mornings, especially when she felt rushed or stressed, her readings would jump into the high 140s or even 150s. It worried her every time she saw those numbers. Her doctor asked about her routine. Dorothy admitted that on those mornings, she often checked her blood pressure right after waking, before even sitting quietly or having breakfast. She was sometimes still thinking about the tasks ahead, what errands she needed to run, what phone calls she had to make. Her body had not yet settled into the day. Her doctor suggested a small change. She was to sit in a comfortable chair, take 5 slow breaths, wait at least 5 minutes, and then take her reading. No phone, no television, just quiet rest before measuring. Dorothy tried it. Her numbers improved almost immediately. On calm mornings with that simple routine, her systolic readings dropped by 10 to 15 points compared to the rushed days. The medication had not changed. The only thing that changed was the few minutes of calm before measuring. There are a few same-day habits that support this kind of improvement. The first is calm breathing. Before checking your blood pressure, take several slow breaths. Inhale for about 4 seconds, hold briefly, and exhale slowly for about 6 seconds. This activates a calming response in the body and reduces temporary spikes caused by stress or rushing. Some people find that doing this for just 2 or 3 minutes before a reading makes a clear difference. You can do this at home, in your favorite chair, with no special equipment. The second is proper hydration. Dehydration can affect blood pressure in different ways. In some cases, it can lower blood pressure. In others, it can make the heart work harder to pump blood through a body that does not have enough fluid. Drinking enough water throughout the day helps maintain steady circulation and supports more consistent readings. A good goal for most older adults is about 6 to 8 cups of water or other non-caffeinated fluids each day. Adjust as needed depending on the weather, your activity level, and any guidance from your doctor. The third is light walking. A short walk after meals or in the morning can support better blood flow and more stable readings over time. Even 10 minutes can be helpful. Walking does not need to be fast. A slow, steady pace is enough to get the circulation moving without putting too much strain on the body. This is easy on the joints and can be done indoors or outdoors. If walking is difficult, even standing and moving in place or doing seated leg movements can help. The fourth is avoiding sudden position changes. Standing up too quickly, especially in the morning or after sitting for a long time, can cause blood pressure to drop suddenly. This can lead to dizziness or even falls. Moving slowly and pausing for a few seconds after standing helps the body adjust. If you feel lightheaded after standing, sit back down and try again more slowly. These are not replacements for medication if medication is needed, but they support the overall picture and help you avoid unnecessary alarm over readings that are temporarily elevated. If you have chest pain, fainting, or feel sudden pressure in your head, seek medical care right away. But for everyday management, These small actions can make a noticeable difference. Steady habits support steadier readings. Let me mention again, if this information is useful, consider subscribing. New videos come out regularly and each one focuses on simple, clear advice for blood pressure and blood sugar. No complicated terms, just things you can actually use. Now let us look at the longer-term habits. These are the routines that, over weeks and months, help build a stronger foundation for blood pressure control. 6. Longer-term habits have a real impact on blood pressure over time. While same-day actions can help with temporary spikes, the foundation of blood pressure management comes from consistent routines over weeks and months. These are the things that add up quietly in the background. Charles is 73. His blood pressure had been creeping up over several years. It went from the low 130s to the mid 140s. He was already on one medication and did not want to add another. His doctor suggested looking closely at his daily habits before making any medication changes. Charles thought his diet was fine. He did not add salt to his meals. He avoided chips and salty snacks, but when he looked more closely at what he was eating, he noticed something. He was eating canned soup several times a week. He used bottled salad dressings. He sometimes had deli meat for lunch. All of these foods are high in sodium, even without adding salt at the table. He made a few changes. He switched to low-sodium versions of soup or made his own at home. He made simple dressings using olive oil and vinegar. He replaced deli meat with home-cooked chicken or fish. These were not dramatic changes. He did not go on a strict diet. He just became more aware of where the sodium was hiding. Within a couple of months, his blood pressure dropped to the mid-130s without adding any new medication. His doctor was pleased. So was Charles. Sodium is one of the most important longer-term factors for blood pressure. For most older adults, reducing sodium to around 1,500 to 2,000 milligrams per day can make a meaningful difference. Most of the sodium people consume comes from processed and packaged foods, not from the salt shaker at the table. Reading labels helps. Choosing fresh foods over canned or packaged ones helps even more. Another longer-term habit is regular gentle movement. This does not have to be intense exercise. Walking for 20 to 30 minutes most days, stretching in the morning, or doing light strength exercises all help. Over time, consistent activity supports lower resting blood pressure and healthier blood vessels. If you are new to exercise or have joint issues, start slowly. Even 5 or 10 minutes a day is a good beginning. You can build from there. Stress also plays a role. Ongoing stress raises blood pressure. When the body is constantly in a state of alertness, blood vessels tighten and the heart works harder. Finding ways to relax, whether through walking, hobbies, time with friends, gardening, or simply sitting quietly with a cup of tea, can help bring it down. Some people find that having a daily routine with a few moments of calm built in makes a big difference. It does not have to be formal meditation. It just has to be something that feels restful. If you make a major change to your diet or start a new activity routine, check with your doctor first, especially if you are on medication or have other health conditions. Some changes can affect how your medication works. Building steady habits builds steady blood pressure. Here is a small tip. If you want to track your sodium, there are simple apps that let you scan barcodes on food packages. They show you exactly how much sodium is in each serving. Even using one for a week or two can be eye-opening. If you are finding this helpful, please take a moment to subscribe. Every new subscriber helps this channel continue making these videos, and it means you will not miss future tips on blood pressure and blood sugar. Now here is something many people overlook. 7. Sleep quality affects blood pressure in older adults more than many realize. What happens during the night matters for your daytime readings, and many older adults are not getting the quality sleep they need. Helen is 69. Her blood pressure was well controlled during the day, usually in the low 130s, but her morning readings were often in the 140s or 150s, especially right after waking. She mentioned this to her doctor, who asked about her sleep. Helen admitted that she often woke up several times during the night. She sometimes snored loudly. Her husband had noticed that she occasionally seemed to stop breathing for a few seconds and then gasp. She always felt tired in the morning, even after what should have been a full night's rest. Her doctor referred her for a sleep study, a test that monitors breathing, heart rate, and oxygen levels during sleep. Helen was found to have mild sleep apnea, a common condition in older adults where breathing briefly stops during sleep. Each time breathing stops, the body reacts by raising blood pressure slightly to push more oxygen through. Over the course of a night, this can add up. Helen was given a simple device to help keep her airway open at night. It took a few days to get used to, but within a few weeks, her morning blood pressure dropped noticeably. She also felt more rested and had more energy during the day. Even without sleep apnea, poor sleep can raise blood pressure. When sleep is fragmented or too short, the body remains in a state of higher alertness. This raises stress hormones and can elevate blood pressure over time. Good sleep habits include keeping a consistent bedtime and wake time, avoiding heavy meals or caffeine late in the day, keeping the bedroom cool and dark, and limiting screen time before bed. Some people find that a short, relaxing routine before bed, like reading or listening to calm music, helps them fall asleep more easily. If you snore loudly, feel exhausted even after a full night's sleep, or have morning headaches, consider asking your doctor about sleep apnea screening. It is more common than many people realize, especially in adults over 60, and it is treatable. Restful sleep supports better blood pressure readings. Most older adults can improve their sleep quality with a few simple adjustments. It does not require medication in most cases, just consistent habits. We are now at the 8th and final point. This one connects blood pressure to something else many older adults are watching closely. I mentioned earlier that one of these items would show how blood pressure relates to another health marker. Here it is. 8. Blood sugar and blood pressure are more connected than most people realize. Many older adults deal with both blood pressure and blood sugar concerns. These two issues often appear together, and one can influence the other in ways that are not always obvious. George is 75. He had been managing high blood pressure for over a decade. His readings were usually in the 130s to 140s, which his doctor considered acceptable for his age. But over the past year, his numbers had been creeping higher, into the high 140s and sometimes the 150s. His medication had not changed. His diet had not changed. He could not figure out what was different. At a routine checkup, his doctor ran some blood tests. George's fasting blood sugar had increased significantly. He was now in the pre-diabetic range, close to the threshold for type 2 diabetes. His doctor explained that higher blood sugar levels, over time, can damage blood vessels and make them stiffer. This makes blood pressure harder to control. The two problems were feeding into each other. George started making a few changes. He added more vegetables and fiber to his meals. He began eating smaller portions of bread and rice. He replaced sugary snacks with nuts or fruit. He went for a short walk after dinner each evening, usually about 15 minutes. These were not extreme changes. He did not count every calorie or carbohydrate. He just shifted his habits in a healthier direction. Within a few months, his blood sugar improved, and his blood pressure came down with it, even though his blood pressure medication stayed the same. His doctor was encouraged by the progress. This is one reason why blood pressure and blood sugar are often discussed together. They share many of the same risk factors, including weight, inactivity, poor diet, and age, and improving one often helps the other. The same lifestyle habits that lower blood sugar, like eating more fiber, moving after meals, and reducing processed carbohydrates, also tend to support healthier blood pressure. If your blood pressure has become harder to control lately, it may be worth checking your blood sugar as well. And if you are already managing blood sugar, know that keeping it steady also supports healthier blood pressure. If you take medication for blood sugar, especially insulin or anything that lowers glucose, be cautious when changing your eating or activity patterns. These changes can affect your blood sugar levels, and adjustments may be needed. Always discuss significant changes with your doctor first. Comment below if you track both blood pressure and blood sugar. I would like to know how many of you are managing both at the same time. Supporting one often supports the other. Let us bring this all together. Blood pressure targets for older adults are not the same as for younger people. A reading that looks slightly elevated on paper may be perfectly acceptable for someone in their 70s or 80s. At the same time, pushing too hard to lower blood pressure can lead to problems like dizziness, falls, and fatigue. It is about balance. The key is knowing your personal target, measuring accurately, and paying attention to both the top and bottom numbers. Same-day habits like calm breathing, light walking, and resting before measuring can reduce temporary spikes. Longer-term habits like reducing sodium, staying active, and getting quality sleep help maintain steady readings over time. And if you are also managing blood sugar, remember that these two health markers often move together. If you have any questions about what target is right for you, talk to your doctor. Bring your home readings. Ask what range they are aiming for and why. That conversation alone can bring a lot of clarity. If you know someone over 50 who could benefit from this, share this video with them. And if you have not already, subscribe for more simple blood pressure and blood sugar tips. No complicated terms. Just calm, clear information you can actually use. Take care of yourself.